Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing 5 qualities that every wound care professional should have. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So the first on our list is having great listening skills. So the physical exam itself can provide so many clues to the etiology behind the patient's condition, but we need to be listening to our patients as they're going to give us so much information by just talking to them. They normally will pretty much tell you anything that's wrong with them, any complications that they're having, any pain that they're having. But we just have to listen and not be cutting them off. We need to be empathetic, active listeners. This is going to help diagnose them. It's going to help effectively manage and treat them. It's going to actually save us time because when we establish that trust, they're willing to give up so much more information. And when it comes to wound care, we have to kind of conform to their lifestyle too, because if they're not going to keep up with the proper wound management that we've given them, if they can't for some reason either do the wound care themselves or they don't like the looks of it, they're not going to do it and they're going to use a different product. So we have to use our listening skills and work with them to figure out something that's going to work for them. Next, we have teamwork, okay? Wound care is a multidisciplinary field, so we need to be able to collaborate with podiatrists, vascular surgeons, wound care specialists, nurses, assistants, even occupational therapy, physical therapy. We need to be able to collaborate with them to have an improved patient outcome, okay? We're going to share decision making, okay? There is a whole field that we need to be looking at because we can't just be treating the hole in the patient. We have to treat the whole patient, okay? The patient as a whole, not just the hole in the patient. That is so critical. And so if we're looking at the patient as a whole, we have all these other fields that we have to deal with also collaborating, and it will heal the wounds quicker. Next, we have perseverance, okay? Chronic wounds, they are complex and wound healing can take a really long time. Patients may not always respond to initial treatment. Wound care is not a one size fits all, okay? So what you have seen maybe a million times, oh, this has worked great on this type of wound. It may not work for everybody, okay? There are factors, age, comorbidities, physical factors that can delay wound healing. So we need to be able to pivot, recognize the signs that we need to be moving on, changing what we're doing, use something different, and be able to just keep going to heal that wound. We need to be these patients' advocate, okay? They can lose all hope when wounds start not healing. They can lose hope, but we need to persevere and give them that hope and keep working to heal that wound for them. Next, we have enthusiasm for lifelong learning. So even though wounds have been around for as long as humanity, there are always advancements emerging within this field. So the science and therapeutics, an increasing body of information, there's always new techniques coming out. So we need to use this evidence-based information to manage our patients, okay? It's going to help wound care professionals excel and provide better care, because if we're not, it can consequently affect patient outcome, where patients aren't healing as well as they could be if we would just keep up with that lifelong learning. So we need to just consistently be upgrading our skills, going to different courses, relearning information, because I know me personally, I've gone to things that I've already went to, but there's new information added. So we always want to be relearning, refreshing our brain when it comes to the wound care profession. So lastly, we have attention to detail. So wound care is complicated, it's complex. Everybody has their own treatment strategy. The attention to the fine details can give you a better guide to the treatment plan that you're going to use, okay? It's great to see the bigger picture of, okay, we're dealing with a venous leg ulcer. This is what we're going to do. But you have to be watching for careful details, okay? This is going to give your patient the best care. It can also catch underlying medical conditions, because a lot of patients with chronic wounds, they do have underlying issues. So say, for example, we have someone who has slight swelling in their legs. They have a sore on their legs, so their doctor just writes them up, and I've got this many times. Wound care. Okay, perfect. So we're going to provide this wound care, but they're not being treated for their swelling of their legs, okay? When I see swelling of the legs, watching that little detail gives me great clues, okay? So I see the swelling, I recognize that's venous disease. Well, I start talking to my patient about that. Are you being treated for the swelling in your legs? Has your doctor seen this? You know, just talking to them about it. And sometimes it can be a great thing just chit-chatting with them, because a lot of times I've come in contact with patients and their doctors don't even know their legs are swelling. They seen a doctor early morning, their legs weren't really swollen. I'm seeing them in the afternoon, and every afternoon their legs are completely balloons. So that attention to detail and just a little quick chat about that has me sending off a fax to the doctor or nurse practitioner, and then they're being treated for these issues, okay? They're going for further testing, seeing if their legs can withstand compression, seeing if there's any arterial disease with that. So just a small little attention to details can change so much. And in return, we're going to get so much quicker healing, because when we're fixing the problem instead of just the hole in the patient, we're going to prevent prolonged issues. That wound's going to heal so much quicker. So attention to detail is very important. So if you're a nurse or have been looking into the wound care profession and you think that these 5 qualities really match with your personality, then this is definitely a great career for you. So I really hope this video helped, and I hope to see you guys in my next video. Bye.